It was a midweek afternoon, or just a little bit past 1500, 3 in the afternoon.
I remember receiving the first phone call, which was actually from dispatch, the fire department.
And all of a sudden they say, and you could tell by their voice and how they're, not only the content, but by the emotion they're conveying, that this is big, and that they're feeling overwhelmed, and that a lot of people are coming and they want to make sure we're ready.
Embrace all the stuff and get ready for something major.
We have a disaster. We need to go into code triage immediately. There's been a bus crash, and we have multiple injuries and fatalities.
We knew there were going to be deaths, we knew there were a lot of injuries, and there was a lot we didn't know.
It was a bus of Girl Scouts, about 65 in all.
We did old school Girl Scouting, that's what I call it. We were camping. 104 people plus leaders on 2 buses.
Our heads leapt to school-age children, and so we started quickly emptying out the emergency department of the existing patients and making room, and we actually configured some of our monitors and our equipment for pediatric patients because we assumed that that was going to be the age group.
Back in those days, not everyone had cell phones, not everyone had fax machines, there were no text messages, but very, very quickly, via telephone and via pagers and answering services, the call went out.
I realized it was only 10 minutes away, and if they're overwhelmed and it's not sure who's responding, maybe I could be of help. So I just grabbed my car and drove out there.
It was a horrible, horrible disaster.
It was almost like being in a movie. You know, we were moving, and I knew that we were moving, but I heard nothing. I didn't hear talking. I didn't hear screaming. All I heard were the brakes were out, brace yourselves, and then
the bus went off the road, went off the chassis.
I have no memories until lying on the rocks. It was it was really, really hot. I have no idea how I got there. I can't imagine that I could have walked there. How could I have gotten through that window?
In these school buses, seat belts aren't mandatory, so it's sort of the tumbler effect.
That bus was just mangled.
We really had to leave it surrealistic and not think about anything very personal. We're just going to find who's alive and maximize the response.
Someone did come over to me and say something along the lines of, do you know your name? Or, can you tell me your name? I'm Stephanie, I'm from Cincinnati, Ohio, and I can't breathe.
At one point I thought I found someone. It was a girl by a rock and another girl underneath, and I thought, well, maybe she's alive. And I called the guys over and I turned it, but they were both dead.
It could have been so easy for any of those girls who were not physically incapacitated to just walk off or just lay down, and just focus on taking care of themselves, which I don't think anybody would have blamed them for. But they went back down there, or they stood there, or they directed you to where you needed to be. And I think that comes from being, a Girl Scout.
I get goosebumps even thinking about it today of what I saw.
We saw broken ribs, we saw broken pelvises, we saw broken limbs, we saw head injuries, we saw coma, we saw respiratory failure requiring intubation and mechanical ventilator dependence, collapsed lungs and things like that. We just saw a myriad of very common, blunt, traumatic injuries.
So we had to make sure that we were getting the right patients to the right place the first time, and so that may have involved coordinating patients going to Eisenhower or JFK depending on their injury, so that we could spread the patients out a little bit and make sure that we got the ones that needed to come to us.
There were 3 or 4 helicopter companies there and every conceivable ambulance from throughout the valley. Police, fire, very large number, very quick, very well organized. Landing zones established, ambulance loading areas established.
And then we saw Sonny Bono and a couple other people who were known in the community that kind of wanted to be part of it and do what they could.
It's events like this that really, really pull everyone together.
Doctors came out of the woodwork. What can I do? Because it's spread around the valley rather quickly.
Everybody show up and everybody tried to do something. Everybody asked how we can help.
We had gurneys lining the circular driveway with landscapers, construction workers, maintenance workers, and other hospital support staff unloading the helicopters and bringing the patients into the emergency department.
The injuries were not unusual. You know, we were used to taking care of critical trauma patients. So the only difference here is the volume, right? And the fact that they're all arriving within 2 hours.
In the span of about the next 25 minutes, we would receive 23 or 24 very, very critically injured Girl Scouts.
Heidi had people going, it's had Dr. Simmons and Dr. Aronson. They were both working on one girl. One was working on her face, the other was working on her knee. And I never see the cooperation and the collaboration. No egos, just medicine.
You could turn over and look over your shoulder, and there were 3 doctors standing there. You're looking over your shoulder, and there are nurses staying who would have been scheduled not to be here, and those coming in who weren't here. Okay, it was just an outpouring.
And it called upon people to put aside any idea or definition of what their job description was and step up and do the right thing.
Everybody, this was an emergency room to care for those girls.
The community came out in full force, standing in line to donate blood, delivering food, making accommodations available, offerings of just about everything that you can imagine, coming to the hospital, into the lobby, into the waiting rooms, beginning that evening and continuing for days thereafter.
Each person wanted to do all that they could. They wanted to help.
To do what they know, help and give the best care to those girls.
You know, the people who were still here and the people who were regionally local, the people from other parts of Southern California who maybe were on the other bus or part of the original council that did the trip, they would come by and visit. So then you got to see them too. So it was kind of like a community within a community.
From start to finish, it was about 3 weeks from the time that the first patient arrived until the last patient was discharged from the hospital.
Those were probably some of the hardest times, I'm sure, for some of the people who took care of these patients, because they had, you know, they had their contact and their relationships with them grew because they had longer periods of contact with them.
It's obviously left a lasting memory with all of us, not only professional relationships, but friendships. I've been invited to a wedding. I went to the wedding. I've been kept up to date on childbirth and things.
I forced myself to move forward, and maybe that is what, you know, helped me. And then of course also allowed me to realize, okay, some of these things are normal. Maybe some of these things aren't, so maybe I need some help. And then I can move forward. You can't let something like this stop you from living life, and that you can't let anger or bitterness consume you. It's hard, but you have to try to find the silver lining.
You can never predict the human factor in these types of events. You can't plan for it, you can't predict it, but once you've seen it in action, it changes how you think personally, it changes how you work professionally, because you know that's the piece that is consistent, never fails.